Hi, my name is Kelly Locey and I'm the Communications Coordinator for the Benton County Health Department. Today I'm pleased to let you know that we have no new cases of COVID-19 in Benton County. We'll continue to provide daily updates on our website at 1 p.m. Monday through Friday. We know that a lot of you have had questions about the types of information we release when we have new cases of COVID-19. So today our guest is Benton County Counsel Vance Croney, and he's going to talk about protected health information.
Hi, I'm Vance Croney, Benton County Counsel, and today I've been asked to talk a little bit about information, medical information, health information that Benton County can and cannot release to the public. Typically, we are bound by federal and state law when it comes to type of information we can and cannot release. Unfortunately, during the COVID-19 pandemic, we are still bound by the same laws. The first law that typically binds Benton County from what it can and cannot disclose to the public is the HIPAA privacy law. Most people are aware of HIPAA. It's a federal regulation that prevents providers, insurers from disclosing information about health records that could help identify an individual. HIPAA isn't really a law that is relevant in this instance because most of our patients are not the patients who are contracting COVID-19. What is more relevant is Oregon state law as it relates to pandemics and public health emergencies. State law is very prescriptive and explicit in what it tells us we may and may not disclose. We cannot disclose information about the health status of an individual that will allow anybody to identify that person. We can gather information, but we can't disclose it. So we're often asked, who is the person that tested positive? We're not allowed to disclose that information by state law. We understand that kind of information is certainly of great interest to the public, but our hands really are tied by state law in what we can provide to the public. The other information that we're often asked is, can you tell us information about where the individual who's tested positive has shopped, where they worked, where they've traveled, where they visited? That is really a different kind of an inquiry, and candidly, I mean, that's a valid request. If I'm somebody out in the public and I know that somebody perhaps in my neck of the woods has contracted COVID-19, I'd like to know where I can go and where I can't go that may not put me at greater risk. But the bottom line with that kind of request, we don't get that information. The information we get on positive tests comes from the state of Oregon. And the only information we get from the state relates to the age, the gender, the race, provider and testing information, and contact information for the individual. We have no idea the history of the individual. We don't know where he or she might have been the previous 14, 7, 2 days. We don't know where they work. We just don't have the kind of information that we're being asked to provide. So we have two limiting factors when it comes to disclosing information to the public. One, of course, is Oregon law, and that's pretty much inviolate. The second is we just don't have the information. If we had a legal basis to release information, we would do so. If we had facts we could release, we would do so. We just don't have either right now. And unfortunately, that's the way the law is written, and Benton County as a government of the state of Oregon, we are bound to follow the law. I hope that answers some of your questions. I know it doesn't answer all of them, but right now, that's, I think, probably the most pertinent information relative to the type of questions we've been getting the last couple of weeks. Thanks.